there's a scenario unfolding right now in Ontario pretty much every day that I think is perhaps not all that fair, not all that reasonable. And I want to get your thoughts on this scenario and whether or not you think it's something that should in fact be happening or not. So right now in Ontario, there are about 200 people a day who are testing positive for COVID-19, confirmed to have the virus. And they are being instructed by public health to quarantine, to isolate at home for 14 days. And their family members must also isolate at home for 14 days. Now, they don't break down the makeup of these individuals in terms of how many are vaccinated, unvaccinated, just one dose, double dose, that sort of thing, how many have symptoms, how many are asymptomatic. I mean, later on, there are various studies that come out and tell you that data, but when you first learn about the number of people who've tested positive, they don't tell you all that kind of stuff. But I can guarantee you, of these 200 people a day who are being confirmed to have had COVID-19, to have tested positive for it, some of them, we don't know how many, will be people who are double vaccinated and have no symptoms. So basically, have just showed up on a test to be told, yes, you have COVID-19. Otherwise, you wouldn't know it. They got the vaccine. They got no symptoms. Those people and their families are being told by threat of major fines from the government that they cannot leave their homes for 14 days. They and their children, vaccinated people, no symptoms, and their kids can't go out of the house during this beautiful summer for 2 full weeks after you've been denied, because there's been lockdowns for about a year and a half, regular living now available in Ontario, things you can do, but you must stay at home. Do you think that is fair? Do you think that is reasonable? Dr. Dina Henshaw in Alberta clearly thinks it is not. The Chief Medical Officer of Health there, she has said, look, in August now, we're not going to do this. Happening in a couple of weeks, the rules are going to change in Alberta, where if you test positive for COVID-19, well, she wants you to take it seriously. She wants you to take precautions. She doesn't want you to be cavalier about it. So if you're showing symptoms and so forth, be respectful, common sense, do what you can to avoid spreading this virus. But no more is there going to be forced government quarantine. Now, there's a lot of people who are having a tantrum over this in Alberta right now, but eventually we're going to have to head in that direction in every province in Canada. Pretty much every country is going to have to head in this direction sooner or later. It's really just a question of when, because as Dr. Dina Henshaw said, there are other things to weigh, there are various challenges, there are other medical issues that are arising, things that require the attention of public health. And this idea that you've tested positive for COVID-19, but you very well may be double vaccinated, you could have no symptoms, and you've got to keep an entire family locked up in their home for threat of sometimes exorbitant fines over this. Is that really the sort of society that we want to live in moving forward? Eventually, do we not have to ghost away from those sorts of things? And people have wrongly criticized Dr. Dina Henshaw for saying, well, that's the let her rip strategy and so forth. No, it's not. Of course, she's been speaking very much about the need to take these viruses seriously, the need to minimize spread, take precautions, and so forth. But is there a need to keep those people who, they may be double vaccinated and so forth, they may have no symptoms, to keep them at home under lock and key, them and their children, for 14 days? Is that reasonable or is that unreasonable? What do you think?